I have the pleasure of introducing our next speaker, Dr. Let me get the... What I like about her is that she is one of the first doctors of audiology in the world, and she was the first in Canada. It's pretty impressive, huh? And yay! So Dr. Berg completed her postdoctoral fellowship in neuroanatomy and auditory processing from Dartmouth Medical School, New Hampshire, and she sat as an adjunct faculty at Pennsylvania College of Optometry. The School of Audiology from the inception of the Doctor of Audiology program in 2000 through 2008 until Salus University and the George Osborne School of Audiology was formed. And Dr. Burge's primary interest is in the investigation of the clinical profiles of rare diseases and complex comorbid neurological patients and patients who suffered whiplash, TBI, PCS. Please welcome Dr. Brenda Burge.
Great. No, I'm right. I'm hiding.
I'm hearing impaired, so this is perfect.
Hiding behind. Oh, sure, I can help you with that later.
I can't tell where you are.
Thank you. I just want to start by thanking Nora for inviting me, and this is all Patrick's fault, so if there's complaints, I think you have to direct it to him. And I think I'm going to start the presentation by saying, yeah, what he said. Because Patrick has already shown you the McGurk effect, showing you that the eyes will override the auditory system. He's already shown you the optokinetic tunnel, showing you guys that the eyes will override the ears and the vestibular system, so I'm out. I'm going to leave on a Seinfeld high note and say, yep, just what he said. So the issue of the circus act and dragging me behind on a little red wagon goes back a little ways. Patrick asked me to go to the first COVD conference in Canada, and I was told I could say this, you know. He says, Brenda, I need you to come and shame my colleagues. He says, I need you to tell the story of the first 8 years of your practice. I said, okay. So the story behind this is, in my practice, of course, as an ear doctor, people would think of referring to me to question their dizziness and vertigo. And without fail, when there was a deficit, and I got to deliver the good news to the patient saying, great referral from your family doc, and the good news is your ears are great. But I need you to see your optometrist, because what's happening is your eyes are sending an error message to the brain. So your eyes are lying. And so this eyes are the liars thing sort of comes back from me harping at Patrick that this is his system. It's always his system. It's never me because I'm the princess. And so without fail, the patients after seeing their optometrist would come back, well, they wouldn't come back to my clinic, but they would be calling into the office that day, bawling their eyes out, begging to speak to me through my staff, because they're distraught, because they actually feel that it's their eyes. And they were saying, can I please just talk to her? The optometrist doesn't know what she's talking about. And I didn't have anywhere to go with that. I wasn't sure how or why this was happening. So hence the term, why the eyes are the liars, because this is an ongoing joke with Patrick and I, that he's always lying to mother brain, and I'm usually good. So the talk today, so after the fact that everybody's already shown that your system is far more powerful than mine, and it's that influential, clearly I'm your biggest fan, and I am like the biggest cheerleader for the neuro-optometrist and the FCOVD optometrist. Hands down your biggest fan. How do I, just to do the disclaimers here. Many of the slides that I'm using come from my colleague, and I'll give you a little bit of detail of my colleagues, just as you have some of your greats here, I understand, and I've met Dr. Singman and I've heard of Dr. Padula, and I'm quite disappointed and upset with Dr. Zielinski's presentation was so fantastic. I was up till 2:30 in the morning still working on my slides. So your people are really very, very impressive, and I just want to thank you. So in my case, one of my colleagues, Dr. Richard Gans, is what I'm pretty sure many people would say is the world-leading expert in dizziness and vertigo. Dr. Gans has personally examined every astronaut that's flown a US spaceship. So if they're going to let you fly that billion-dollar plane, I'm pretty sure they don't want you pooching it because your vestibular system is pooched, right? So Dr. Gans is the person that we're referring to. And when Patrick was mentioning AIB certification, I think it's like FCOVD, if you look at my colleagues, let me just go back one. I put his website on there for a reason. I'm going to be uploading all of my slides because I think I just admitted to you that I was up till 2:30 in the morning still working on them. So you will have these. So www.dizzy.com lists my colleagues who are board certified in diagnostics. Also, but the positive is, Richard has recently really expanded his offerings, and he has always been doing VRT, but that now seems to be much more of a focus. He's brought on DPTs to the American Institute of Balance to do the VRT teaching and other concussive aspects. So you can see the different practitioners by scope of practice. So let me move quickly to a little known thing, and I'm actually glad somebody came up and mentioned to me a couple minutes ago that once upon a time the specialty in medicine was the ear, eye, nose, throat surgeon, right? The EENT. And so it's separated. I think that was a really great reminder for those of us that have the gray hair and actually still do remember that. And your interesting comment was, isn't it interesting now the professions are merging and coming back in close to demonstrate the interplay of all of them. So what I wanted to do is review the 7 otic symptoms of concussion. Okay, so I'm not the ENT, I'm like you guys, I'm the non-surgical ear person. Once upon a time, I think if you go back into the literature, the EENTs used to call concussion late onset cervico-encephalic syndrome. A specific description of what we talk about with concussion, right? Late onset cervico-encephalic syndrome. And it holds a myriad of things. Eyes are a problem, ears are a problem, neck's a problem, all the headache symptoms. So, of course, I'm going to just stick within my scope of practice and talk about these few. One of the little known things is I think I'm going to start with the auditory portion because I don't think it gets very much play, and yet you guys know this because one of the biggest symptoms that always links together is what? Visual overwhelm and sound overwhelm. You're visually sensitive and sound sensitive. I don't have any slides on this part at the moment, okay, because I don't have a visual to do this. What I'm going to do is explain to you the classic patient, though. And you guys know this because they're in your doors all the time. So the patient will respond that they can't go out to the grocery store because they're visually overwhelmed, and they can't tolerate sound, right? So well-meaning practitioners, and this won't be you guys soon, might actually suggest that people use sound suppression, earplugs, noise-canceling headphones. Make sense? Unfortunately, that's contrary to my literature. So it's a very compassionate, really thoughtful, considerate, empathetic thing to do. But unfortunately, in my literature for over 20 years, what we know is that sound sensitivity actually has a diagnosis. And it's called either, or and in both, misophonia. And misophonia in Latin stands for emotional aversion to sound. Or hyperacusis is actually pain to loud sound. Okay? Most of the time, the patients are not actually hyperacusic, they're misophonic. Okay? And so that sound sensitivity has an incredible sympathetic response. Okay? So just like your patients with their peripheral vision system collapse like their horses with blinders on it, their auditory system, if we can imagine and make this analogous, their auditory system is doing exactly the same thing. But they can't really describe it. It's just, I don't like sound, I can't stand it. They can be my 3 best friends and we're having wine and I just want to punch somebody out, because, like one at a time. And if you actually watch their body language, right, their visuals are telling you everything. That means stop, right? Stop, 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 right? One at a time. It's all they can tolerate.